So why would I use a BD syringe instead of a normal dermal filler syringe? We had lots of questions about this, so I thought I'd do a full video comparing and contrasting the different devices so that you can make a better decision about when to use each. Don't forget to stay to the end because I have a very special guest joining me from Australia who's going to help us understand some of the important differences between regulation in the UK and Australia and in America, and why that might be different if you want to use a BD syringe. So in this clip, you can see me using a BD syringe in the nose. The reason I often use a BD syringe in noses is because I'm often not using a full mil. It's quite useful if you're doing an adjustment or a small treatment to just use a small amount of that product. This also gives you greater control when injecting. And this for me is the biggest difference between BD syringes and the devices that the dermal fillers come with, which is the amount of movement for the plunger in a BD syringe is much more for a smaller volume. So in the case of noses, I like to use small amounts, little and often, so to speak. So a small injection, check capillary refill, and this is the easiest way to avoid the main thing that people worry about with noses, which would be blindness. You need to inject at least 0.085 mils to have any chance of filling the vessel all the way back to the eye, which is what everyone worries the most about. So the easiest way to reduce that is to only inject 0.05. And the best way to control that is to use a device that is very clear about how much you're injecting. The difference between a normal dermal filler syringe and a BD syringe is probably about twice as much movement required on the BD syringe to put the same amount of product in. So if you have a look at the smallest gradient on this syringe, that is equal to this whole space in the BD syringe. So compressing this from here to there would be the same as this whole movement here. If you actually look at the distance the plunger needs to move with a BD syringe compared with a normal filler syringe, it's about 2.5 times further for the same amount of product. Effectively, you could say that it's 2.5 times more accurate to use a BD syringe. Does using a BD actually alter the result? I don't think it alters the result, but it gives you more certainty when you're injecting about exactly how much you're injecting. Because one of the problems with these devices that the product comes with is that you're often looking from different angles. So if you imagine looking down with the needle from this position, it's actually even harder to see how much movement there is in the plunger. So what you get as an injector is a greater degree of certainty with how much you're injecting. There's less plastic involved with the BD as well. So your plunger is closer to the wall of the syringe, so you can actually see more clearly where the plunger is compared with one of these, particularly at an angle, and the amount of movement to get the same result is so much more, as we've discussed. So this overall, in my mind, creates a greater sense of certainty about what you're actually doing during procedures. And it's particularly useful in any procedure where you're very concerned about putting a small amount in at a time. So typically this would be tear trough, some of the details in lips, and of course noses. So if I like BD syringes so much, why am I not using them in every area? Well, it's mainly for the reasons I've just said. A lot of the areas that I treat, I don't really need that much discernment between different volumes. It's okay to be within a 10% error margin when you're injecting larger amounts in areas that are basically less sensitive to tiny differences. So what about the risk of vascular occlusion? Do you increase the risk of a VO by using a BD syringe? Well, the reason that I use BD syringes is actually typically to reduce the severity of vascular occlusion. It doesn't necessarily reduce the frequency, but I know they'll be smaller. So one of the other downsides of using a BD syringe that some people discover is that the compression force, the extrusion force required to inject can be much higher, particularly on thicker dermal fillers. So this is one of the natural changes that happens to do with changing the physics of the syringe, the amount of movement. For the same reason as it increases your accuracy, when you've got a thicker product, means you've got to push harder for longer to get the same result. So this could be one reason why you might reserve using BD syringes for lower viscosity products, or you may just decide to go to the gym and exercise your thumb a bit more because it really is just a matter of pressure. So one of the things I've noticed on social media is that the Australians seem to respond very differently to some of my videos than the rest of the world. And I'm getting the idea over time that you guys are much more regulated and controlled than other parts of the world. So I thought I'd get an expert on the subject matter, someone who's got a fantastic point of view from 2 different countries, which is Jake Sloane. Jake obviously originated in the UK, but also now works and lives in Australia. And so he can give us an excellent insight into the differences between regulation, at least between those two countries. So I thought I'd ask him some questions.
Maybe I'll give a bit of a backstory because I think it will help color the whole conversation. So, unlike the UK, I've obviously worked in the UK and injected in the UK, but having moved here, it's obviously abundantly clear that there are different regulatory expectations and guidelines to work within. And, traditionally we sort of look at the UK as being pretty loose and, there's not too much regulation, whereas, here it's quite different. So I guess it's probably hot on people's minds here in Australia as well, because we've just gone through another round of extra regulation or a sort of a rejig of the rules. So everyone is sort of on high alert to do the right thing, I guess. That was, there's lots of nuances to those new regulations, but they kicked on July 1st of this year, so not that long ago. So in reference to your question about BD syringes, I mean, just from a forget which country in, I think it just sort of boils down to a simple fact that if you have a pre-filled syringe with a supplied needle or cannula from a supplier, let's say, I don't know, let's not use a name, but a big pharma company, and then you change the parameters of that and use your own needle, own syringe, and potentially during that decanting process, there's an issue of potential sterility or no sterility, then I think it's just logical to argue that maybe that's not how it was designed. Forget the law in the country. So I guess here in Australia there would be injectors sort of looking at that practice, and maybe they're trying to do the right thing because the spotlight is on injectors to do the right thing with the new regulations. The way it works here in Australia is that each injector either is a doctor, a cosmetic doctor. We have obviously registered nurses. We have nurse practitioners who are a little bit more autonomous, so they can prescribe for themselves like the doctors. But registered nurses work under the supervision of a prescriber. So, if a registered nurse decided to go off label or off piste, if you like, that would sort of have to have been discussed with the prescriber because the prescriber's job is to look at the patient, talk to the patient. They come up with a treatment plan. Normally, it's done virtually on a Zoom call or a FaceTime call. And then, the nurse institutes the treatment. So if the prescriber doesn't deem that, kosher, if you like, then by definition you can't. For patients who want to have surgery with a plastic surgeon or indeed a cosmetic surgeon, they have to be referred through their GP. Whereas, traditionally, if I saw a patient on my bed and I thought, oh, you're appropriate for a blepharoplasty, I will, verbally or formally send you to a colleague who does blepharoplasty. I can't do that now. I'm not allowed to get involved. They have to go through their general practitioner, which has caused, a lot of anger because, of course, it clogs up the GPs with all these people just wanting cosmetic surgery referrals. And of course, the general practitioners don't feel like they have an understanding of what they're sending for. That's not their territory often. So it's sort of created a bit of a roadblock for patients and surgeons to be connected. And there's a few other things. One of the other ones was that patients wanting to have cosmetic surgery, sort of by definition, have to go through a psychological screening now, which we won't go into the sort of the details, but it feels like a bit of an overreach. But a good surgeon would argue they would have done that anyway. It's their due diligence to check someone's mental capacity before an operation. So anyway, whereas that was when these guidelines were being sort of announced but hadn't quite come into play, there was a fear that that would also be the case for us as injectors. And, it sort of puts a lot of your patients on the back foot to basically say, right, I'm going to go through these mental health questionnaire now to deem you worthy of having Botox. In practice, of course, I don't, yeah, but in practice, I was sort of doing my own screening process anyway prior to the law change. So from my perspective, I don't feel much has changed. But what I am doing is using a validated questionnaire now. So again, if anything ever happened medical legally, I can actually say, well, I used a validated screening tool. That's the best we've got. And of course, I spoke to the patient face to face. I guess the nurses will probably feel the new regulations more than than myself. I'm a prescriber, I'm a doctor, and so even though there's a few sort of additional things that I have to do with my patients now that I wasn't doing before, really in practice, it's same old. My patients fill out some forms, we have a consult, and if they're appropriate and they agree, we do a treatment. Whereas with the nurse, sorry, the prescriber sort of looking after the nurse, it does feel like there are a few more hurdles, a little bit more formality to the process. And of course, if things go wrong, there's more responsibility of the doctor or the prescriber to sort of get involved. So yeah, I think it has maybe changed, but there's always a fear when new regulations come in that you're doing the wrong thing. So there was always that anxiety that you might get audited by the regulator or whatever. But I think things have settled down, and people have realised, okay, it's not a huge change, and actually maybe some of the regulatory changes that have made things a little bit more black and white as to what is expected. It's actually good for the patient, rather than sort of casually going through the motions when you're consulting. There are certain things that just have to be done. So you could argue that it's good, but yeah, I think the changes were more for those registered nurses under the supervision of a prescriber. Yeah.
The next thing to consider might be whether there is something in BD syringes that could negatively affect filler. Now, I don't think there's any clear evidence that this is the case, but there is a theory that silicone oils used on the inside of syringes, which may even be on the inside of filler syringes, can trigger inflammatory responses. If you haven't seen this video, there's an interesting study published by Dr. Maria Landau. In this video, I discuss this idea of morphia-like lesions, which are caused potentially from silicone oils inside BD syringes used to inject botulinum toxins. And what this results in is a little small indentation that patients get after being injected with botulinum toxin. It's very rare. I've seen one in my career, but it is a potential risk with dermal filler and the same oils. Now, I've yet to find a patient that I can definitely identify as reacted to dermal filler after a BD syringe injection, but that is a theoretical risk that you may want to consider. I don't think it's high risk at all, and that's why I continue to use BD syringes, but it is worth thinking about. You can watch that video on morphia-like lesions here, and I hope you found the rest of this video interesting and helped you make a better decision about whether you'd like to use BD syringes or not.